Hello, and welcome to our YouTube channel, where we discuss all things related to Medicare and Medicare-approved plans. Quite simply, when clients come to us, we help them in three ways. First, we unconfuse Medicare plans for them. Then we answer all their questions, and then we show them which plans they're eligible for, all at no cost. Now, today we're talking about Medicare Part D costs. Please be sure to like our page. And if you're looking for quick yet thorough explanations of the various parts of Medicare-approved health insurance plans, please be sure to also subscribe to receive notifications when we post new information. Now, Medicare Part D plans, of course, cover prescription medications. There are several costs that can be associated with Medicare Part D plans. They include the monthly premium, annual deductible, initial coverage stage costs, coverage gap costs, and catastrophic phase costs. The monthly premium, this is the amount that you pay to the Part D plan in order to receive the benefits the plan offers. Monthly premiums vary and prices depend on what's available in your coverage area. Now, in addition to the monthly premium, you will also pay varying costs as you progress through the various phases of your Part D coverage. First, the annual deductible. This is the amount you must pay in full each year for your prescriptions before your Medicare drug plan starts to pay its share. Some Medicare Part D plans have a $0 annual deductible, but most Part D plans have some amount for an annual deductible. As an example, $480 is a common annual deductible for Part D plans. Now, the first stage is the initial coverage phase, in which you pay co-pays or co-insurance, whichever one your plan requires. A co-payment is a fixed amount you pay for a covered prescription. Co-insurance is a percentage amount you pay for a covered prescription. You pay this until you reach a drug cost maximum. The next phase is the coverage gap, sometimes referred to as the donut hole. You pay 25% of the cost of your drug prescription medications in this phase, and not everyone enters the donut hole. The phase after the coverage gap is the catastrophic phase, in which you pay a fixed amount for prescriptions through the end of the year. Now, the actual cost of your prescriptions will depend on a number of factors, and they include whether your prescriptions are on your Part D plan's formulary, which is the list of the drugs covered in your Part D plan. Depends on what tier the drug is in, and tier 0 through 5 is typical. The higher the tier, the higher the cost of the drug. The drug benefit phase you're in, and of course, we just covered the various phases. The pharmacy that you use. So whether the pharmacy is a preferred pharmacy where your cost sharing will be lower, or if the pharmacy is a standard pharmacy where the cost sharing will be higher. And then it'll also depend on whether you receive extra help. So let's talk a little bit about extra help. This government program is available for individuals with limited income and resources. Extra help is administered by Social Security and CMS. You can apply for extra help online or call the Social Security Administration. Now let's talk about the cost of insulin. For people on insulin, there may be Medicare Part D plans that offer significant savings for insulin. For example, $35 might be the maximum you pay per month for insulin. Now, if you're charged a late penalty fee, then your monthly premium will be higher. A late penalty fee may be added because of enrolling in a Medicare Part D plan after your initial enrollment period ended and not having creditable prescription coverage for 63 consecutive days. Now let's summarize what we discussed today. We talked about the cost of Part D plans. the monthly premium, as well as the cost in the various stages of Medicare Part D prescription plans. Well, I hope you found the content informative, and thank you again for joining us today. Do like our page and be sure to also subscribe so you won't miss new weekly videos providing more helpful information about Medicare approved plans. You take care and be safe. Bye-bye.